in the agency. So we definitely wanted to catch up with Guam Regional Transit Authority Director Cel Babauta because the agency, the drivers, the staff, they interact routinely with some of the people who tend to be hit hardest by the coronavirus. People with comorbidities. We got a dialysis center right next door, Mr. B, and mass transit comes through all the time, dropping people, picking people up. So that's why I wanted to get you on. And if you could, we'll just give you the floor. Can you tell us everything we need to know about COVID-19 at the Guam Regional Transit Authority? Good morning, Mr. Cel Babauta. He's the director.
Morning, Chris. Good morning, Sabrina.
Good morning.
As usual, we continue to adhere to the precautionary measures that public health had put forth for all government Guam agencies, and essentially, we practice social distancing, we wear the mask, and of course, we sanitize as often as we can. And that goes with also ensuring that our riders are safe. And with that, we make sure that the buses and vans that are used to transport our riders are sanitized twice a day, once in the afternoon and once in the evening. When the buses return back, they get sanitized and ready for the next morning. And when riders show up to ride on the bus or vans, they're given a sanitizing wipe, and also their temperatures are taken to make sure that they're not harmful to any of the others with regards to COVID-19.
Was
So
the
go ahead. I'm sorry.
oh, sorry. Was the employee a bus driver?
No, ma'am. The employee was not a bus driver. The employee is one of our support staff.
I
But
see.
she works with another individual in an office, so it's not like she's out there with riders or all of the other office staff.
Right. Are there plans in place? Sorry if I missed it, to test the all of the staff at the agency, Mr. B?
Well, Chris and Sabrina, I reached out to public health, and I was told that those who are going to be tested sooner are those who have spent at least 15 minutes with the patient, and that within 24-hour period, and also that they've been communicating with people within 6 feet. So the catch is again having been close to the patient with
Right.
at least 15 minutes within 24 hours. Those are going to be tested. Those people are going to be tested Monday, and all the others, we've been actually have been advising them to ensure that if they feel uncomfortable relative to the symptoms of COVID-19, that they get tested right away.
Right.
And the other thing that we did was we reached out to Fire Chief Stone, and fortunately he provided us with his decontamination team, and the Transit Management Center where the patient was working has already been decontaminated.
Right.
So,
Mr.
yeah,
B.
and the other thing also is, despite all of this, we're continuing to maintain our normal operations.
Mr. B, is that good enough for you, though? Because I know you care about the staff there at the agency or the authority. If you had your way, would you want all of the employees at your department to be tested for the virus? Are you satisfied that they're only going to be testing the so-called close contacts? Would you like that peace of
We,
mind?
Chris and Janella, safety is very, very important. So that's number one. So I'm meeting with my staff daily, and I've made it clear yesterday. As a matter of fact, even the day before, I spent almost 21 years in the United States Air Force, and we prepare for war, we prepare for contingencies, and this is really we talked about contingency measures the day before yesterday to ensure that this war against COVID-19 the GRTA responds effectively. So I've made it clear to them that in the event that they're not comfortable, I want them to get tested immediately. So I'm really keeping a close eye on everybody as usual.
So it sounds like you want them to get tested just for your own peace of mind.
Uh, well, see, yeah. Well, I'm gonna have to talk to the experts on that, Chris.
Yeah.
I mean,
You're competent though,
that's
Mr. B. I can tell that, I mean, if the virus is so widespread everywhere and you've got your drivers going out and picking up the mononco and, people with comorbidities, I have a feeling like you want everyone to get tested, but you just can't.
Well, again, I'm going to make sure that my folks are safe. And really, the other thing that I wanted to pass on is that the Federal Transit Administration has reached out to me and informed me that they want the number of people who are working with the Guam Regional Transit Authority, because they are looking at making sure that when the vaccines are available, that the Federal Transit Administration will provide enough vaccines for GRTA employees. So, GRTA, Chris and Sabrina, man, it's been in existence for over 10 years, and we're doing our best within, the last almost 2 years to make things better. But transit, we're preparing to make sure that when hopefully these COVID-19 issues are resolved, the GRTA is ready to provide a more reliable and safe transit system, much better than what we have right now.
Right.
I mean, so we have electric buses that were part of the $9.5 million. We have another $1.9 million to do feasibility study on Uber-type transit system for Guam. So in addition to everything that we're doing, so yeah, it's been challenging, but we're coping.
Right. I did see your citizen-centric report outlining some of the challenges that you face, but you also provided the future outlook, like you mentioned, for GRTA with the purchase of the electric buses and things like that. But you guys really have received a lot of federal funding to make several different improvements and purchases with your agency. Can you tell us more about that?
Yeah, we've been taking advantage of every opportunity that we have with regards to funding, because it's clear that the local government, really, honestly hasn't been very supportive, really in that matter. Everything that we're purchasing, let me tell you, GRT has 23 buses and vans. We're getting ready to buy by the end of 2021. If everything goes well with our procurement measures, we should have another 20 fossil fuel operated buses. And this is besides the 8 electric buses and 8 electric cars that we're bringing on board, and that's all federal funds. Really, $2.9 million for FY21 is the budget for GRTA. And I spend a lot of time or some time doing research to make things better. And in areas that are comparable to Guam, like Maui and Kauai, their budget is, it's not a laughing matter. Their budget is like $9 million. So, with what I have, we're working hard to make things better. Right. But if I have something like what Maui and Kauai's got, I think better things will come faster.
Right.
Yeah, I see it here. Acquire a piece of government property that GRTA can use to build a transfer station with all the amenities for riders. I mean, that's interesting.
Yeah.
You want to establish an apprenticeship program, build a park and ride facility in Dededo.
Yeah. And really the park and ride, as you can see, Dededo and Jigu continues to grow. In addition to that, Anderson Air Force Base is growing. The Marine Corps base is coming up. All those 4 areas will comprise of perhaps maybe at least over 1/3 of Guam's population. So there's going to be in addition to now, there's going to be much more congestion. So if we have a park and ride up there and allow people to park their cars and get on the bus and travel to their destinations, I think we can help reduce congestion in Guam.
Yeah.
And of course, people will be able to go to work with public transportation.
Nice.
And one thing that a lot of people don't tend to realize, public transit is never a money-making venture. The dividends that public transit brings to the government is the fact that when it brings people to work, they pay taxes. They reduce reliability of social programs. They reduce the earned income tax credit.
Right.
They go out and spend money for quality of life stuff. So
Amen.
that's the big dividend
Yes.
of the good transit.
Yeah, no, Mr. B, we totally support it. Transit's been underfunded, underrepresented, under everything for how many years? So
Under the bus.
Under the bus. Hey, I remember reading something in a FOIA I sent back in the beginning of the pandemic where you were trying to procure some new buses. Did that ever happen?
And it's under protest, and hopefully this week it will be resolved with the OPA and the parties concerned.
Lana due to protest. Oh man.
And the other thing is, this is my first time working for a government of Guam line agency. I come from the best Air Force in the world. I come from Guam Community College. I worked there for 9 years and then left. And so it's been a big challenge. Really, I want to be honest with everybody. Big challenge. I've never done this before. Yeah.
You don't sound too excited. I've never been through all this before. Okay, Mr. B.
And I haven't given up, and I will not give up because I told the governor that I'm going to be with her till the end. So, and the lieutenant governor, right?
No, we're all going down together, Mr. B.
Yeah.
We're on this ride.
Chris,
Buckle up.
And you know what, Chris? Historically speaking, ask Sabrina way back when I was a member of the board over 20 years ago. Sabrina was out there interviewing me many times.
Yep.
Yeah, no, I love getting you on. I like it. You always have your 2 cents or $5.
It's straight up, I like to say.
Yeah,
Just
Mr.
straight up.
Babauta, thanks for your time this morning. I know you got to go to a meeting, but again, thank you for coming on and giving us the info.
Right.
Not a problem. Thank you for giving me the opportunity.
All
Have a
right.
good day.
Stay
Anytime.
safe.
Yes, appreciate it. Wash your hands. Jay, what do we got? Hold on, sir.
Oh, we actually have a special virtual parting gift made by our very own DJ Joe, sir. We have virtual sweet spaghetti
Oh, nice.
with a banana ketchup
Yes, Filipino style, Mr. B.
and quartered hot dogs.
Enjoy.
Okay.
All right.
Take care.
I don't know if you're diabetic or not, Mr. B, but portion control.
Take care.
That's the,
All right, take
okay.
care.
802. Yeah, guys, it's Jason's week to take care of the virtual snacks in the K-Wave News Zoom room.
virtual menu.
We're all over the culinary map this week, baby.
That's why a lot of people are turning down the interviews this week. They're like, oh, no, Jason's doing the food. No, wait till next week. Guys, on KUAM TV, thanks so much for jamming with us this morning on this Thursday, the 29th day of October, Ordinary Time. Appreciate